So how do you know if you have high hydrogen peroxide going on clinically? What are some of the clinical symptoms you might see? So if hydrogen peroxide builds up and you don't neutralize it, you can end up with premature graying of your hair or early onset of acid reflux in your patients, or just reflux in general. So those are two clinical tip-offs that the catalase or glutathione peroxidase genes may be mutated or not functioning as effectively and efficiently as they should. But there's this ox-redox paradox. It's like the Goldilocks phenomenon. A little bit is good, too much is bad. It has to be just right because you need small amounts of that superoxide again to fight infection and to stay in hormetic balance. So I'm going to present a case in regard to a test that I've been running. Again, as I love to split tests, various tests to say, does it give me valuable information that's going to equate to actionable steps I can take to improve a patient's health? And this oxidative stress test is from Vibrant America, and it looks at more than just lipid peroxides and 8-ODG, which are two common ones many of you know about. It measures multiple oxidative stress markers, and it's a simple urine test, looking at protein oxidation, looking at DNA damage, RNA damage, and even lipid peroxidation. And so remember, you need your lipids to be in high number in that small, dense LDL particle, and it also has to be damaged to deposit on our arteries. So she actually has active breast cancer that is being held at bay through a natural treatment she is getting from another doctor that I'm not as familiar with. And these are all the oxidative stress markers she has. So she has DNA and RNA damage present in her body. So this is serious in her case, and we want to mitigate this. So I took her through my executive edge protocol and look at the results on the left and then look at the results on the right, which was 4 months later. So that was just not too long ago there. We've eliminated the DNA and RNA damage that's being seen, and we're on our way, hopefully, to clear the remainder of that oxidative stress. So I'm going to share what I did with her. I walk everyone through that 3D protocol that lays the foundation so everything else works. I leveraged her genetics, so I know where her mutations are in the detox pathway. So we support those with the cofactors. And I help her live long well by deploying some of my anti-aging and peptide strategies. So this is a case study of a very high performer who I had known and treated, so to speak, in the past, and started to complain of a newer onset of brain fog and fatigue. At the end of the day, she just wasn't functional, and not only from a brain fog standpoint, but from a fatigue standpoint. So she wasn't herself. And I sat her down and I kind of went through what are the triggers for inflammation that could be going on, and really said it's got to be toxins because I knew she had a history of exposure to mold in the past. So that's what I suspected based on that. She ate clean. She was on a lot of supplements. She slept right. She was very active. She was engaged in her community and not solitary, etc. And I prescribed the following protocol, and she messaged me 13 days later and said, my brain fog and fatigue are all gone. So what is it that I did? So remember, free radicals in excess, you can actually mop up like with a sponge by using molecular hydrogen. And many companies make this. Quicksilver has H2O elite. Research Nutritionals makes H2 absorb. In her case, because the symptoms were so profound, I utilized it twice a day for a short time period. So we mopped up the free radicals. Then I gave her SOD and catalase. So there's only one company I know that makes that in a combo formula, and it's called Dysmuzyme. I gave her that twice a day. And then I also supported her glutathione pathway by giving her liposomal glutathione twice daily. Now, while I resolved her symptoms, the key thing is to find out what triggered this. So we got to, on the back end, figure out what led to this. Was it recurrent exposure to mycotoxins? Was it another toxin? Is she nutrient deplete? Are her digestive enzymes inadequate? She's not absorbing the nutrients. Does she have a microbiome that appears dysbiotic? So it's out of balance. So again, it's great that we got our symptom resolution, but never stop asking, why did it occur in the first place? And here's where I'm going to share with you some proprietary information. Shh, don't tell anyone. I'm just kidding. But after many years of running Nutrigenetics on hundreds, if not at least 1,000 patients, I started to observe this clinical pattern that was present in nearly 100%. Never say 100%. There's always going to be someone, right? Of my chronically unwell patients, the ones that came in disabled from work, maybe even in a wheelchair. I've had a couple come in wheelchairs that we got back to walking. Or those that presented with symptoms earlier. So, a woman that was not even 30 and got her diagnosis of breast cancer. And she was at high risk, of course. Thankfully, they caught it early. So you want to look at this pattern. And it involves 3 genes, GSTT1, GSTM1, and GSTP1. So they're all glutathione genes. And the first 2, GSTT1 and GSTM1, you can have 0 copies. And what I observed was all these chronically unwell patients had 0 copies of each of these genes. And that third gene was singly mutated or heterozygous. So they had a really terrible functioning glutathione pathway. They were going to struggle with clearing xenoestrogens. And this is the pattern that was present in myself. And if you don't mind, I'd love to share my story. So it started with fatigue. And fatigue, I wish I would have known, was connected to this. Then it was infertility, which is hormone related. So I wasn't clearing xenoestrogens. In my teens and 20s, I was using the cheapest products available because I was a broke, starving college and medical student. And even as a resident, didn't make that much money, which then led to endometriosis, again, driven by those toxins, PMS, those toxins and not having them clear, causing that estrogen dominance, vision losing, migraines. I lost vision in my eyes in this pattern. It's called bilateral hemianopsia, and lost my speech twice. So if that isn't scary, I don't know what it is. I thought I was having a stroke. And that went on to the next diagnosis and the next. And I have had at least 3 autoimmune diseases: Hashimoto's, eczema, asthma. Those are all autoimmune. And in my mid-40s, my tip-off was when I attended my first functional medicine conference in LA. I flew from the Middle East. We were living abroad all the way to LA, and I was slated to return back. And I happened upon a nutraceutical table where the rep and I were making small talk. And he said to me, "You must be so excited to go back to your kids." I said, "I am, but," I said, "I'm not excited to face 4 weeks of jet lag," because in my early 40s, the jet lag went from 1 week to 2 to 3 to 4. It was incredibly bad. I was non-functional, like in the day when I barely made it through medical school and residency and fell asleep standing up at the drop of a hat. And so he said, "Here, take this glutathione and go to Whole Foods and get some melatonin. Start it today," and that was the day before I was leaving, "and continue it till you feel better." I was simply amazed. Within 3 days, my symptoms were gone. What a stark contrast. 3 days versus 4 weeks. But I didn't know my genetics. I didn't even really know functional medicine. I had just gone to my first course. And what then happened was in my mid-40s, I was so fatigued that I felt like I was going to die. Worse than before. I ran my labs, and it was the first time my labs were not normal. My liver enzymes were 10 times normal, 150. And I felt it, not like my patient Denise, who had no symptoms at all. And they were entertaining the diagnosis of autoimmune hepatitis. I even went on to a liver biopsy. And the minute I told the gastroenterologist that when we were abroad, I was taking Seasonal Seasonique, it's an oral contraceptive used to keep the symptoms and endometriosis at bay. Remember, I didn't know functional medicine. I was just doing what the doctors told me, taking that oral contraceptive that is contraindicated when you have vision-losing migraines or it'll cause a stroke. So again, I'm just following what I'm told, not really thinking it's going to do me harm. And I had to switch to a different formulation. I ran out. I was abroad, so I just got a different formulation of estrogen. The minute I said that, she says, "I see estrogen doing this." And now I know glutathione helps support estrogen clearance through the body. There you have it. Everything was hormonally related. And I sometimes wonder, what if that first doctor who had given me the diagnosis of Hashimoto's said, why? Why did this happen? Like I said in the high performer, why did you all of a sudden get brain fog and fatigue when you've been so well so long? And here are the disease implications. It can increase your risk of cancer, particularly bladder, lung, colorectal, and breast. It's a lot of risk. And it is associated with increased atherosclerosis, endothelial dysfunction, myocardial infarction, because of the oxidative stress accumulation. So pay attention. Observe if you're running Nutrigenetics. Let me know. I'd love to hear from you. Have you observed this as a pattern? I sure have. And I support patients differently. While we're actively detoxifying them, you bet your bottom dollar they're getting it twice a day. If they have cleared all their toxins, whether it's environmental, heavy metal, or mold, then I may supply them with glutathione once a day. I certainly take it once a day. And when I fly, I bump it up to twice a day. So that's just my approach because I know the severity of symptoms that can ensue if you don't support this pathway.
If you're a licensed healthcare practitioner ready to evolve your functional medicine practice, explore over 300 hours of clinical training, masterclasses with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at afnlm.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.